Marine, all the best. All the best, everybody. All the best to you too, Vishakha.
Yeah, like.
Good evening, everyone. On the second day of PsychXPLORE, on behalf of NSS Unit and Department of Psychology, I'm Mehreen Siddiqui from FYBA of Royal College of Arts, Commerce and Science would like to extend a warm welcome to our guest speaker, Ms. Vishakha Punjani. And I would also like to welcome Anaga Reddy and our live participants to the Intercollegiate webinar, that is Professional Ethics in Counseling. I take this opportunity to briefly mention about our college. Settled at the heart of Mira Bhainder township of Royal College, a dream project of our founder, Sir, that Professor A.E. Lakdawala was established in the year 1989. The mission statement of our institution is educational upliftment of poor and needy students, especially girls from minority community. Our motto is empowerment through value education. The institution, under the aegis of Royal Higher Education Society, in Ismail Kanga Educational Campus has English Medium Girls School, Urdu Medium Girls School, and College of Education and Research for Women. Our college offers the programs of BA, BSc, BSc CS, that is Computer Science, BCom, BMS, BAF, and MCom in Advanced Accountancy. A hallmark of the college has been the impeccable record of near 100% results at the university level since its inception. In 2019, the college has been re-accredited with an A grade by NAC in its third cycle. Recently, in 2021, our college has been awarded the prestigious District Green Champion by the Ministry of Government Education of India for its beautiful verdant campus and various green endeavors. To a layman, counseling is like reading one's mind. As I ponder on the counseling as a professional, I am reminded of the words of Carl Rogers, and I quote, "In my early professional years, I was asking the question, how can I treat or cure or change this person? Now, I would phrase the question in this way: how can I provide a relationship which this person may use for his own personal growth?" End quote. Truly, counseling is a professional relationship which provides a milieu for personal growth of the clients. So, we can say that counselor assumes the role of a helper. To be an effective helper, one must tread with caution and care, maintain integrity, and demonstrate accountability. This webinar, we desire to deliberate on these very important principles of counseling with the assurance that our participants will benefit through this session. On this note, I request Sanya of TYBA to introduce our guest speaker. Thank you.
Sanya, is it with me? Because I can't hear you. Yeah, even Rita is doing the same thing that we can't hear you. You can keep it open. The door. Just...
Am I audible now, ma'am?
Yes, Sanya, I can hear you.
Sorry for the delay, ma'am.
Problem. We are one all now.
I'm honored to introduce to you all our resource person, Ms. Vishakha Punjani. She's a great encouragement to all the budding psychologists. Ms. Vishakha Punjani is the youngest co-founder of Astitva Clinic. She has worked in psychiatry and pediatric departments of various government and municipal hospitals. She conducts various health and mental well-being workshops. Her hard work and dedication in reaching out to people has led in extending her honorary work to our country's largest component of armed force. Ms. Punjani is also a counselor at the Pre-Litigation Center at High Court of Bombay. It is a moment of great honor and prestige to have Ms. Vishakha Punjani here with us today. She will be educating us today about professional ethics and counseling. Without further delay, I request Ms. Vishakha Punjani to please address our live audience. Thank you.
Thank you, Rita, first of all, who's been a fantastic colleague and a mentor. I think she's doing fantastic work when it comes to the field of psychology. So thank you, Rita. Thank you, Royal College, and thank you, principal and the faculty teachers. Very kind of you to have me here, and I love coming back to this college because you guys are one of my favorite colleges. And I like, speaking my heart out, and it's just nice to interact with all you young students. Nonetheless, also I'm extremely sorry for everybody who's live and here for the delay. I had some technical glitch. Actually, technology and I really don't go very much hand in hand. So extremely sorry for that. Yeah, I will just share screen. Yeah. Either Sanya or Marine, please confirm if you can see the screen, please.
Yes, ma'am.
All
It's
right.
visible on the screen.
Okay. So here we are. I'll also need this. So give me a minute. Yeah. So a big hi to everybody. I know it's like a Friday afternoon. We are hitting 4:22 on the clock. We had some good lunch and now we are here. Let's make it interactive in case if anybody wants to sleep. Please put a thing on the chat box so I know that you guys are sleeping. Yeah. Rule 1, I'm going to keep my language extremely simple and informal. So if there are any professionals or teachers, really sorry, not trying to demean anybody or I wouldn't know what the designations are. So I prefer calling you all by the first name, and I would request you guys to call me by my first name too, in case of any queries. Any questions, we could address it in the last. I have kept good amount of 20-25 minutes for the Q&A. So yeah, YouTube live questions, I would request either Sanya or Mary to help me out with the chat box. Yeah, we are good to start. So hi Rita, hi Ronak, hi Sana. Hi Afsha Salmani, hi Sayada, hi Alia, hi Rufan Nayak, and then everybody who's on YouTube live. I'm sorry, I'm not very good at it, so can't see the names. So yeah, moving ahead. So hi, how are you feeling today? Any one of you can actually just unmute and tell me how you're feeling today.
Absolutely great.
All right. Anybody else?
Excited for the further event.
I hope I live up to it. All right. Thank you. Anybody else? One more can go. Do we have Ronak here? It's good to see. Ronak, how are you feeling today?
Awesome.
All right. Okay. So, professional ethics. Okay. Can anybody tell me what are professional ethics? Anybody? What do we mean by ethics? Anybody?
Principles or the decorum of something which should be maintained.
Perfect. Correct. So here we are to discuss what basically ethics are. And as very correctly put across, that ethics are nothing but a discipline, a decorum, a framework. So we know that we are, all of us have, we are binded to certain things, and here we are to follow them. Yeah. So I'll start with the bitter truth. The other day, just, the team and I were sitting while I was making the presentation, and we were like, why not present you guys with a bitter truth? So what he correctly said, most counselors have an appreciation for the possibility and diversity of ethical issues, but it's easy to think they'll never happen to you. I still remember when I was a student and I was like, yeah, okay, ethics is nice. We can always study, but I don't think I would ever need them. Yeah. And here right now I am abiding to every ethic possible that I can. Despite serious consequence, ethical issues are common, and without preparation and reflection, many might be violated unwittingly. Okay, it's not a spelling error, it's not unwillingly. That's what my colleague Heta said. Vishakha, is it unwillingly? I'm like, no, it's unwittingly and with good intentions. We always want to help people, so we always take the extra mile so we feel good. But most of the times, in at least my clinical practice, what I've seen is anytime any junior psychologists or counselors, while they're into sessions, either individual or group, it's always out of the good intentions of the counselor that the ethics are broken. Yeah, so that's the bitter truth. And hence I was glad when Rita told me that, we need to have professional ethics. I'll be more than happy. So moving further, let's go for true and false. Let's make it more interactive. So we start with the first one. Respond true or false, okay? When practicing counseling or psychotherapy, working without a defined counseling code of ethics is a bit like sailing a ship without using a compass. What do you guys think? Is it true or false?
Yeah, ma'am, I think it is true.
Okay, fantastic. Second one, during the course of counseling or psychotherapy, the counselor can reveal their personal information. This is a tricky one, but yeah.
Yes, ma'am, they can. Self-disclosure.
Okay, so may I know who said that?
Rufa Naik.
Okay, so Rufa Nayak, you think it's true or it's false?
It's true.
Okay, and what would it be if I tell you that it is false?
We can share information, self-disclosure, but in
Okay.
limits.
Okay, here I didn't say about the self-disclosure. The word said that is personal information. So is it true or false?
That is confusing me now.
Yeah, it is a tricky one, Rufa. So of course it is false because what here I'm trying to indicate is you can give in your personal demographics, right? At the start of the course. What did I say? During the course of counseling or psychotherapy, you can give in your personal demographics, but not personal information. Okay, not at the start of it while you're just trying to understand and you're moving ahead of it. So self-disclosure, what you said, that can happen across sessions, little by little when you think it's needed, but it's not ethical for us to reveal all the personal information about us. So that is false. Okay?
Okay, ma'am.
Yeah. Ethics include protecting clients, improving the well-being and relationships of others, appreciating the diversity of perspectives, and honoring personal integrity. True or false?
It's true.
Okay, fantastic. And the last one, ethics are different for different counselors depending upon their specialization.
No, ma'am, it's false because everyone has the same code of ethics that they follow.
Perfect, Hussein. High five. Correct. So these were nothing but certain ethics which I just wanted to understand from you guys, that what you all think and how much awareness and knowledge we have. Okay, now 3 important things I'm going to be talking about. Of course, one in depth. I'm not going to move aside from the given topic, but 3 important things, if you can see, 1, 2, and 3, which I have put in, are the building blocks during counseling therapy. Okay, so either counseling relationship or therapy while I'm doing. I'm going to keep using the word counseling because it says professional ethics in counseling, but I interchangeably use psychotherapy as well. So first one, Van Hoos and Kotler in 1985, they termed it, and it's beautifully termed, that says, ethics is nothing but generally defined as a philosophical discipline concerned with the human conduct and moral decision making. Very correctly, when I asked somebody what ethics are, and they said it's a principle, and we agreed it's a framework. So that's one part of it. Moving to the another extreme part of it comes in your morality, because your ethics completely depend on morals. So morality was given a definition by Brand in 1959, and then it was re-altered by Grant in 1992, that he said that morality involves judgment, evaluation of actions. So involves judgment, meaning we all have this judgment of right or wrong, right? Correct, incorrect, appropriate, inappropriate, right? So that's nothing but our moral judgment of what we think is fair or unfair, right or wrong, appropriate or inappropriate. It's very binary in nature. Yeah, and between both the extremes, while we are oscillating between the ethics and the moral part of it, comes in law. Okay, so it's like our maintaining the homeostasis between both the extremes. That is, law is the precise codification. When I say codification, is under this comes in. So we are giving in codes, right? And under what are you breaching or accepting of governing standards that are established to ensure legal and moral justice. Now here, so we as a fraternity of mental health have a certain code of ethics. legal, the judiciary has a certain code of ethic, and moral has a certain code of ethic, right? Here we merge the three, and depending upon what context are we using it in, we need to completely be aware when and how what comes into action over here. So for me, anytime that I'm speaking about ethics, I make it a point that I have our fraternity ethics, I have legal ethics, that is judiciary ethics, and I have morals in place. Yeah. So these three are a compilation or the building blocks when I talk about professional ethics. Moving forward, what are ethical principles? Now, giving you a heads up to everybody who's live here, while I am doing professional ethics, I have made it a point to incorporate certain, from certain theories and different research. Mainly what I have followed is the ACA, that is American Counselors Association. I would request you guys, so it's a PDF which is available on Google. If you want, I can share it with you guys for further details on it. So I have followed not only that, but I've also put in my, fragments through my practice of almost a decade now, that I think that you guys should also know about this. Yeah. So it's a combination of both the theory part of it. So it is backed up with research and also through my clinical practice. Now, the very important one when it comes is autonomy. Okay. And this I'm talking about is ethical principles. Now, when I say autonomy, what is autonomy? Anybody heard of it ever? Any of the ethical principles ever heard before? Take it: autonomy, beneficence, non-maleficence, justice, veracity, fidelity. Any one of them heard as a part of principle? None of us have heard any of these principles? Okay, so I'll move ahead with the first one that says autonomy. Autonomy comes from the word basically freedom, right? That's the one important ethic that I put across, that you always have a freedom to choose your therapist. Okay. Now, when I say that you have a freedom, is because most of the times people think that they can always have only one therapist and they are not allowed to move from one therapist to another. Now, this I'm not saying in the context of doctor shopping. Doctor shopping basically means, we go to one doctor, then we go to another, then we go to a third one, thinking that, okay, wait, we really want opinions because we have difficulty accepting what the first doctor has said. So you can go to the second one, you can go to the third one, but we never have the ability to say or put across that why we are not continuing with the one that we started with. So first ethic comes is the autonomy. Autonomy basically means freedom. Freedom for both, not only the client, but also the therapist. Yeah. So in case if the therapist does not want to take in a certain case, therapist should be able to put it across, the counselor should be able to put it across that, okay, with self-determination, that for so and so reasons, I wouldn't be able to take it ahead. Then comes in my favorite, that is the beneficence. Nobody's heard about beneficence? Not even heard? I don't expect you all to know the meaning of it, but not even heard? Yes, no? All of you all. No. Okay, so you all need not question that, okay, why don't I know? It is okay not to know, because even I remember when I was a student, I didn't know about this. Yeah, but it's just trying to understand how much should I simplify. Beneficence basically comes doing good and preventing harm. Okay, so there is a code that we say that, if the client comes to me, irrespective whether I'm trained for it or I'm not trained, for it, and the person requires emergency help, I'll be there as a rescue or I'll be there as a help. Okay, so if I can't do anything good, I at least should not be doing anything harmful. So this is what beneficence means. Yeah. Third one is non-maleficence. Non-maleficence basically means not inflicting any harm. When I say not inflicting any harm is when the client comes to us, we already know that they're very vulnerable. Okay, we are like the last resort for them. Like, first they go to their friends, their romantic partners, their teachers, their family members, their cousins. Then they go to pundits or Maulanajis or priests, and then the last resort is always like, okay, why not speak to the therapist to know what is going, inside of me? They're already vulnerable. So we as therapists, just because we are on this side of the chair, it becomes very important for us to not inflict any pain to them. Yeah, very important ethic. Then comes fidelity. We all know what fidelity is, right? Trust. We all know about what infidelity is, I'm sure, but here I'm trying to teach you is fidelity. Now, when I say fidelity, basically means your faithfulness, okay? How faithful are you? Now, here again, for the first one, when I said that a therapist or the counselor should have a freedom, to put it across that, okay, I do not want to take in, but here the counselor should be faithful enough. Okay, she should have that faith that come what may, the client also wouldn't be running away. Yeah, when we say a relationship is built on trust or faith, fidelity is the important quality over here. Now, it is not only about the client running away, but it's also about all the information that client is giving us. How and with what trust and faith do we keep it as a secret or keep it under rather than just spreading out to people even while we are talking. Next one comes justice. Justice basically means how fair can one be. We all have our biases. We all have our favorites. I'm sure even here with a group of people, we'll have our favorite friends, we'll have our favorite faculty member, we'll have our favorite teacher, a favorite parent, a favorite sibling. But here as a therapist, it's important for the therapist and a counselor to maintain fairness. Now, when I say fairness, is basically the objectivity. Yeah. Then comes in veracity. Veracity basically means the truth, your ability to put across the truth. Now, example, if I have to give in over here is a patient comes to me, a client comes to me with, again, emergency. I am there to help, but I do not have the expertise to help the patient or the client who's come to me. So I will take up the patient or the client and I will make it a point to call my senior or my subordinate or my junior or my joint founder and say that, listen, I'm here to help, but I will need your guidance or advice because I do not have expertise in it. Yeah, these are very, very clinically and technically used terms that I have put it because I at least wanted them to fall on your ears. Yeah, moving ahead, I've simplified it further, which is fun. Are ethical dilemmas. Okay, now this is fun and you all can put in all your questions with respect to this and I'll be more than happy to answer by the end of the session. Okay, very, very important is confidentiality. And I think most of the times when I'm speaking to students and I ask them, okay, tell me what are your favorite ethics, and majority of the students, keep telling me that, oh ma'am, I think it's confidentiality because it's very important. Okay, what does confidential mean? Now we need to understand that we as counselors are last resorts. I'm going to keep repeating this because I know, because I've been somebody's 21st therapist as well, and I've been somebody's first therapist as well. Okay, they are coming to us because they do not want to share that piece of information with anybody else because they think that they might be judged. Okay, they are scared, they have a fear of judgment, and they think that if I tell this, A, what if the opposite person takes advantage of me? And B, what if the person just leaves me after knowing that this is the truth of me? So that's when, with a lot of contemplation in the mind, they come to us. Now, we as counselors need to remember that confidentiality also comes with its own terms and conditions, right? So, for example, if there is a minor who is below the age of 18 or below the age of 21, it's important for me to see during my history, if the child is reporting me that, okay, I'm suicidal or I'm having thoughts of committing suicide or ending my life, then here, irrespective of my ethic component, I will be in a dilemma, but I will have to inform the informants or the parents that this is what has come through my case history. So confidentiality basically means everything that the client, the patient, the child, whoever is sitting in front of us is telling us, we need to keep it locked. We can't. Even while today I'm speaking and I'm giving you all examples, I'm not giving you all the demographics and I'm not telling you all where the person is coming from. I'm just giving you all the symptoms and the case nature for you all to understand. But I'm not allowed to give in their personal information. So anything could be their family history, could be their sexual history, could be their past psychiatry history, could be their past suicidal attempts, which they might have failed, could be their sibling or friendship, problems, could be even relationship problems, and could also be with the entire gender dysphoria coming up right now, and our ability to accept and be open towards the entire queer community. Right, all of that, and when they come to us, all of that is too fragile to be spoken very loosely. So that data, I'm using the word data here because that piece of information is very important for the therapist and needs to be confidential. Yeah. Second comes role conflict. Role conflict, when I say role conflict, is most of the times, even when we are counselors or therapists, we come with our own past history, right? Now, role conflict, when I'm saying is, I'm talking about transference and countertransference. Because the patient or the client who's come to us, they're so vulnerable, they are so emotional at a given point of time that they're coming with a few sessions of working through, because we are just the scaffolding. When I say scaffolding, we are just the support. They might start associating and telling us that, oh, you know what, I think you're like my mother, so helpful. I think you're like my sister because you're being there for me. I think you're like my great-grandfather because you're a great listener, right? And then comes countertransference. Even from the therapist point of view, there have been times when the therapist, with the past history, the therapist comes in, might be like, oh yeah, wait, isn't he behaving like my former partner? Isn't he behaving like my professor from high school? Isn't he behaving like my child? So that role conflict does come in. And that ethic will, at that point of time, this ethic is an important role with introspection. There has to be a lot of reflection from the counselor's point of view to know that, okay, is there any transference or countertransference happening? Remember my bitter truth, which said that, it's always out of good intentions. Yeah, it's absolutely out of good intention when the client is calling you that, you're like my mother. But we need to understand that, wait, that is transference that is happening here. So there shouldn't be any role conflict. Now, again, with a role conflict, I would also want to say and talk about is a dual relationship. A dual relationship would be, and very important one, all you students and everybody who's present here, make it a point, we can only be ears to people who know us. Yeah, we cannot be professionals, right? We cannot take the place of professionals and help them objectively. Here, what happens in a dual relationship is a cousin of mine reaches out to me, okay, and tells me I need help. Now, along with me being a cousin of his, I'm only being a therapist, I'm also a cousin of his, right? So I cannot have a dual relationship of being a therapist and a cousin. Why? Because I cannot be a therapist to my cousin is because I already know his personal history and I might come up with my own biases towards him and his family. I'll give you an example. So for example, if I happen to, go for a family wedding, okay, where he's also there, but I did not happen to see him. So the first thing that he might think is that, wait, probably because Vishakha knows everything about me, now she's trying to avoid me in social gatherings, where that might not be my intention, right? So always remember the dual relationships. So for example, even when my friends reach out to me, or my extended family reaches out to me, I always make it a point to either give them a referral to my joint founders, who's Anaga and Heta. If no, I'm more than happy to refer them to somebody else who can give in more objective view. Yeah. Then comes the competence. Very, very, very important ethical dilemma. Now, when I'm talking about competence, I would also be speaking about the qualifications, which is there ahead too, but I'll put in competence over here is how competent is the therapist to take up the problem that is being presented. Most of the times I hear people and I ask students that why do you want to take up counseling? Why do you want to be a counselor? And they always end up telling me, you know what, I love helping people. I like hearing. It just makes me very happy when I'm helping a person, or if I helped two people to come together. Okay, I understand that you're doing that out of good fortune. Okay, but again, when I'm talking and paying, especially when I'm paying professional fees to a counselor or therapist, the therapist or the counselor needs to be competent enough in the area that I'm looking at. I always encourage all my clients or patients or visiting me to ask me about what I'm doing. So Rufa, this is the personal information what I was talking about. So I would give them my demographics. I would give them that what I'm trained under and what my qualifications are. But I would certainly not be giving my personal information, whether I'm married, how many kids I have, what my caste or religion is, or what my political views are. I would restrict that. Yeah. Then comes conflicts. Many a times, even in my clinical practice, I have seen that after around 3 to 4 sessions, I always say 3 to 4 sessions are where not only, we as counselors are trying to, have a mark on the client, but clients are also pretty much doing the same. They also try having a mark, that, okay, wait, am I doing well? Am I not doing well? So in between phase, the first probably 3 to 4 sessions, there would be where the goals of what the therapist and the client had thought of, it might start to deviate, because that comes in comfortable. The client gets very comfortable with you after giving certain point of time, and the client might say that, okay, we're not going to do this. I think I want to do this. So as a counselor, I might allow it once under crisis, I might allow it twice. But the third time, I have to maintain the goals that were set for at the start of the therapy, and I would again go back to what we had to reach. So there could be conflicts with many ways. Probably the school of thought that I follow and they're looking for, could be the eclectic model that I follow and they want to follow. Even when it comes to my homeworks. So I'm very homework oriented, right? Other therapists aren't. And probably if I'm being somebody's 21st therapist, they know what they do not want. So there might be a conflict in there, or probably just even an argument that, okay, I'm late for 20 minutes and I have to say that I'm sorry, it's my protocol, I do not see. We'll be like, no, but I know you, and can we please do a 45-minute session? Again, as a part of ethic, irrespective that has been your follow-up patient, you might consider what you have signed in the contract remains. Yeah. Then comes justice. Justice, again, I have repeated over here because it's not only a part of principles, but it's also a part of your dilemma that, okay, wait, am I being fair to this person? Now, for example, there are few clients of mine, personally, I'm talking about me, who've told me that I'm looking for somebody who's more senior. And I was like, okay, may I know the reason why? So I asked them, and then when they tell me, I'm like, yeah, okay, fair enough. Probably if you're not comfortable with me, I would refer to somebody who's more senior to me, right? It's about being fair. I cannot be sitting there and thinking that, okay, how could you do something this to me? Are you questioning my competence? Are you questioning my qualifications? No, that's about how fair am I being there by giving in a referral or still sticking to what it is. Now, your fairness also comes in as a part of a reflection from a counselor point of view, would be after 3 to 4 sessions that I have realized that I don't think I'm competent enough to take the problem to the desired goal, because I don't think that I'm being able to take the client where the client wants to reach. Am I being fair there, or am I being deceptive? So I make it a point to take my point of view and do justice to the client, telling the client that, you know what, I think I tried through this school of thought, but I think you can do better with this, and I'm referring you there. So that's the fairness the counselor or the therapist needs to follow. Yeah. Moving ahead, degree of dangerousness. Oh yes, this has happened many a times, even in my clinic, where we as therapists need to be, or as counselors, we have to be very careful that it's not only about the, in the danger spot that the client is in, but there are times where even the therapist is in the danger spot. So we need to make it a point that irrespective of that, that we have people outside who are at a rescue. So extreme conditions, extreme clients with having extreme mental health conditions, who would fall into the spectrum of psychosis, okay, or probably real spectrum of neurosis, would be a time where we have to validate and see what is the degree of dangerousness, how much is the danger involved if I'm taking up this client. So that again depends upon the therapist's competence. Yeah. So these are the dilemmas, because it always, gets us back and forth whether we want to take it up, we don't want to take it up. If I'm maintaining confidential, and imagine if this becomes a medical legal case, do I have to tell the judge? I don't have to tell the judge. Wait, I think I am a master's student in clinical psychology, but let me take up an industrial group workshop, or wait, let me not be fair right now, let me just do 4 sessions, and on the 5th session I'll tell the person that, okay, wait, I cannot take it up, right? There are a lot of dilemmas, and why it comes under the ethical dilemmas is because even as a therapist, however we try to maintain the objective perspective or objective viewpoint, we do come with our biases, and we do go back and forth. Why? Because we are humans first. Okay, so my dear colleague Heta and Anaga both keep telling this, that we are humans first, right, Vishakha, and then we are professionals. Because many of the people whom we know always keep saying that, oh, you guys wouldn't be crying, or you guys would be so strong, right? Because you're our therapists and you're our counselors, and you always put across that, I think we're humans first. So yeah, hence it comes under the dilemma. Are you guys there with me? Because I've only been speaking and I'm so used to in person that I don't know whether you guys are there or sleeping. You can just put a thumbs up or something in the chat box, so I know you guys are there listening to me and not sleeping. We could say hi. Okay. Wow, you're awake. Nice. Interesting much? Or very technical? Quickly give me your feedback. Interesting much or very technical? Very technical or interesting? Both. Okay. It's interesting. All right. Okay. So Sayada and who said it's a little? Sayada, I'll try making it more simpler. Okay, don't worry. Yeah. Moving ahead. My favorite, ethical relationships. So ethical relationships I've divided into 2. That's 1 and 2, because this is designed by all 3 of us. So there's Anaga, Heta, and I. We were like, okay, ACA is good, BCA is good, but we thought, why not put in something that we really face, and how important it is for all 3 of us to have a check-in within our own self, that are we in place or no. We need to keep checking the compass, and are we sailing in the right direction or no. Yeah. My very favorite, informed consent. All the budding counselors and psychotherapists or therapists or anybody who's been practicing in mental health further, it would be really nice to see you on field. Very important is my informed consent. When I say informed consent is how much are you informing your client, okay? And how much is your client okay with being informed, right? So that is informed consent. So it's a very safe tool or paperwork, especially when we have to take the legal way, where we put across certain things, that this is what I'm going to use your information for research purposes, or probably just to understand your case better, or to help the medical fraternity or the paramedical fraternity. Is basically a signature that we take in, where I will be doing this, and this is where we are looking at. Always remember, your ethical relationship always needs to be mutual. Now, when I say mutual relationship basically means both me and my client or the patient together have to take things forward. Okay, now your question would be that, ma'am, but what if we get a patient or a client who is not in the correct frame of mind to give the signature? So then we make it a point that we explain everything that we are going to do, and our plan of action or our SOP, however you want to label it, or our framework of working in the therapeutic relationship should be given to their family members or the informant. Yeah, and always remember the language needs to be the one where the person understands, not our primary language, but the person's primary language. In case if we have difficulty, please use translators and please use people who can help you interpret it. Yeah, so informed consent, as I very correctly put across, is how much are you informing the patient and how much is a patient okay or the client is okay being informed. Yeah, so that's informed consent. Next is the counseling plans. Counseling plans basically means a contract. Just give me a minute. Let me check if I put contract ahead. I think I would have. Yes, I have put. Yeah. So counseling plans basically means there are different schools of thoughts. Okay, I'm sure when you guys get into TBAL or when you all get into your masters or the ones who are not from psychology and are just attending, counseling plans basically means you need to ask your therapist what is a school of thought, okay, that they practice. So there are different schools of thought. Somebody has expertise working with cognition. Somebody has expertise working with evolution. Somebody has working with childhood. Somebody has expertise working with emotions. So we need to know that how is a counseling plan going to go, okay, how many sessions would be required, what will be the tenure, right? Now here counseling plans, when I put across, always make it a point to give in what you are doing only after the first consultation. So consultation and case history is a good amount of information that we have, and then probably we can decide that, okay, I think this is what we will work through. So do not only put in what our expertise are and why it should work through, but always put across that in case if this is a plan doesn't work through, then we can always alternate and iterate between plans A, B, and C. So always let them know what they are doing. Don't keep them under deception, right? So if you can see, I actually use walls, like I remember most of the therapists, they have this thing of writing on the paper, which makes the client so curious. Okay, so curious. They want to know that, okay, what is she writing? What if she's writing something bad about me? Or what if she's not understood and she's writing? So make it a point, to use the walls for that specific client that I'm seeing. And I also tell them that before I take in another client, all of this would be erased where the confidentiality is maintained. Yeah. Third and very most important is the records and documentation. I think as a system and as a practitioner, we can really upscale ourselves with records and documentation. I think we are still very loose because we bank on our memory, thinking that, oh yes, I know the case, we remember the cases through their peculiar behaviors or peculiar presenting complaints. But it's very important for us to record and documentation everything is, being said. Now, when I say record, in case if you're recording a video or you're taking a picture, or if you're doing a role play where the client wants to take away, always see through it that the consent is given. We do not click anybody's picture or take the video or put in any information that we're putting across just because so they remember later. So neither them nor us, without the informed consent, we cannot do that. So be very important with records. Now again, records, depending upon what organization you're working in, always ask them that, okay, for how long am I supposed to record it? Because it's different for different. So for private, we keep it for 3 years, and now we are going green. So we scan and we keep it online. So it's accessible anytime. Yeah. Then comes the documentation. Very, very, very important to have a stencil to your case history. Like homeopathy, I always put across like, psychology case histories can go longer and longer. There's so much to write for us to remember. So I still remember during my master's, I have received this stenciled framework of case history and mental status examination. And now I think I do not only feel that, but everything plus and minus that I thought that would be required for me to work on the case. Your case history and documentation is very important, is because you always need to be well read before your next patient comes in or before your next client comes in. You can't be like, oh yeah, wait, what's your husband's name? Oh yeah, wait, what did you tell me what your date of birth was? Oh, okay, so you were born where? We can't be doing that. Your documentation needs to be intact where it's easily accessible to you, and always make it a point to write in your notes of what you have done in this session. It's very, very important for you to understand the patient or the client on the timeline of how well the prognosis is. Yeah, when I say prognosis, is how well and how quickly is the client recovering. Very important, records and documentation. Boundaries. I think boundaries recently has been a word in vogue on social media. I really don't know why, but yes, it's been something really on social media where there are everybody talking about boundaries. Boundaries are very important. Now, if I have to give you an example, anybody who comes to your house rings a bell, right? Or, you know, you can of course go back and check that how unconsciously both the one who's ringing the bell and the one who's opened the door, we do take a second to stand where we are, right? So why? Because the person who's opening the door, that's his boundary, where he's allowing the another person who's rang the bell to come inside. Yeah, so boundaries are very, very, very important for the therapist in a therapeutic relationship. In a counseling session is very important for you to know up to what level. So if I have to give you an example of boundary, I don't know if you guys can see me. Can you guys see me? I think you guys can. Okay.
Yes, ma'am.
Okay. So one important example of a boundary, I've just put the thing here, is with touch. Okay. So while I'm talking to my client, irrespective that the client is of the same sex, I will make it a point that any case, anytime I want to do anything, okay, which requires tactile or if I have to touch. So before doing this, I will ask my client or my patient that, hi, is it okay if I just hold you here? There's a reason why am I doing it. Right? Very, very important. We don't know in what state of mind the person is and how the person might interpret. Okay. Then the proximity of, you know, we sitting. I can't sit with my client or my patient like, oh, hi, how are you feeling? I can't be doing that, right? I'm a therapist. I have to maintain a code of ethics. So always the best way to sit is in an L form. So L form would be if I am sitting here, I'll make Anaga sit in the L, which is here, who's my client. Yeah, it's very important to maintain that so they yet feel closer to you and they do not think as if you're interviewing, because most of the times our therapy tables or our psychiatry rooms are where the table is like that and the client or the patient is sitting right in front of you. Yeah, why? This just looks as if you're interrogating. For a good amount of proximity, try using the L method and it really works. Yeah. So, and there are many other boundaries, you know, it's just that you need to know what you are okay and not okay with. So for me, my important boundary is any time that my client, you know, comes in or walks in, I am okay to handshake, but I am not okay to give a side hug. I do not entertain that because I am personally not very comfortable with, you know, the physical proximity and my physical space. Whereas other therapists whom I've known, they've been very okay. You know, they're like, oh, hi, come have a seat. I am not. So we as therapists need to design for our own self, apart from what the books and the ACA say, that, okay, what are the boundaries that you would want to maintain? Yeah. Very importantly is the romantic and sexual relationship. Romantic and sexual relationship with who? Not with your colleagues, but I'm talking about with your clients. Most of the times we have seen that, you know, the clients or the patients start having different, you know, sexual, romantic gestures towards the therapist. That's not because, you know, they really want to, but they're very unaware of the fact most of the times. There also have been times where they do it intentionally because they know that the therapist is a part of it and the therapist might not say anything. Okay. And the third is that you falling in love with a client or the client falling in love with you. So ACA, BCA has different tenors as in when, how you can continue getting into a romantic or a sexual relationship. But it's a big no-no and a big red flag for you to get into a romantic or a sexual relationship with your counselor while you are in the counseling protocol or the course of counseling sessions, and also for 1 year after you have stopped. So if you know that if somebody is trying to do, any therapist or counselor is demanding this from you, you must know that this does not come with a package of counseling. Yeah. So with your ex-clients or your former clients, or, you know, during the process, we need to know what is a no and what is a yes. Please, I request. Even if you think that there is a touch which you're not comfortable with, like for example, during the boundary setting, if I'm touching Anaga and if Anaga tries touching me back, that okay, now I want to feel how it is. And if you are feeling uncomfortable, you need to put that across to your client. And it is absolutely okay not to move ahead with the therapy or the session or to put across for during that time until you see the client next. And you should, if you really want to be fair, you can always refer the client. Very important. Then comes disclosure. I think Rufa was talking about self-disclosure. So yeah, Rufa, this is disclosure and deception. So disclosure basically means self-disclosure, that how okay and not okay it is for a therapist to speak about them also being in the same place at any given point of time. You know, as a part of empathy or sympathy, there's a difference. So sympathy would be yes, Anaga, I understand what you're going through. Empathy would be, Anaga, give me a minute, let me close my eyes and figure that, okay, what it would be to be in the shoes that you are in. So that's like a slight difference between sympathy and empathy. And your disclosure, I would always put across that it's not bad. It's good, because during that given point of time, when you are doing it is very important. It can either backfire or it can have a great impact. So that completely is a very clinician's judgment as to when and how to self-disclose, because most of the time self-disclosure can also backfire. That, oh, okay, she also has these problems. How will she be able to help? And it can also be like, yeah, okay, even she went through, and this is how she coped. With her coping skills. So if she can, and if she's helping me, she'll have better empathy qualities than another one. So very important. So if I have to give an example of disclosure, a colleague of mine, for example, a colleague of mine who has been recently divorced and who's a therapist, who's a relationship counselor. She has a client and she says that, oh, okay, yes, I know how divorce can be. I just had a recent divorce and I can help you out with. That's not required. That's the piece of information you can give to your friends, but not your client. But in between the sessions, by the 4th or the 5th, when you've realized, okay, the person really wants to put in a divorce, but is facing a lot of difficulties because of the taboo associated with it, then she can always put across, let me tell you something, that even I went through this process and it's been very difficult. So I understand how it would be for you. So it completely depends when and how we want to do the disclosure. It's a weapon with both edges. I keep saying that. Very difficult to know how it would be taken. Deception basically means that, yes, I might portray that I am a good listener, I am good, but probably I might not be qualified. Okay, so most of the times, again, when I talk to students and I tell them that, okay, what do you think is a good quality a counselor can have? And they always say, oh, the counselor has to be a good listener, needs to be an active listener. Yes, I agree. But if you're only being an active listener and your sessions are only being a went out session where you're not taking away anything, then you're deceiving the client by just portraying that, oh, I'm such a good listener, but you are failing to work through the problem and the presenting complaints that the client is putting in. Yeah. So that's with disclosure and deception. There's another part to that, which is contract. To everybody here, just everybody who's live here and who's trying to listen, contract is something which we do in therapy where you have your certain expectations, you call it labels, you call it terms and conditions, you call it rules, framework, discipline, however, it's basically a piece of paper. So that depends upon how you want to do it. Do you want to do it orally? Do you want to do it on a written contract? Could be any, oral or written. Written is always preferred because we have legal, judicially associated to it at any given point of time. There's a contract where we put in the demographics, the presenting complaints, and how we'll be working towards the goals. What is the school of thought that we would be using? If you're doing multi-eclectic, then what are the different models under multi-eclecticism that we would be using? What will be the time of the session? For how long will it go? What are the fees that will be charged? And what will happen in case either of you do not want to move ahead with the contract? Yeah, it puts a very clear image and a clear picture to both the client and the therapist, because at any given point of time, there shouldn't be where the client is working, to another level and the therapist working is another level. Okay, the goal is the same, and also the reaching medium needs to be the same because you are the support and you are the scaffolding to the client. So that's a contract. Opposite of contract is termination. When I say termination, majority of the times I have seen, especially when I was in the municipal hospitals, that clients or patients do not want to follow back, right? And they have signed a contract. Always be open enough and warm enough and flexible, hybrid enough, where the clients or the patients can come and tell you that they no longer want to continue with you and they want to terminate the contract that they have signed. Yeah, here most of the times what happens is clients think that, okay, what will the counselor think? But you are not here to feel right or wrong, good or bad, right? That's the fairness that the client wants to portray or put through. Always allow, be open, be acknowledging. It's okay. So termination here is not only when the client doesn't want to continue, but the termination can also be when the professional cannot continue. And that does not only depend upon competence, it also depends what if me, I have to migrate from here to Canada, or if I'm moving from here to Chennai, okay, or probably I just got pregnant and I am due with my pregnancy, or I just had a death in the family and I cannot. So there are different reasons to termination, but always make it a point, if you have to be honest, put the honest reason and terminate it. And while you're terminating, always make it a point that if you think that your client still requires help, be kind enough for a referral. And if you guys are not going to get into psychology, be kind enough to ask the professional that, hi, can you help me with some referrals? Yeah. And now when you're doing referrals, which is my next point, while we are doing referrals, always ask the person, ask the professional that, okay, is it going to be fee splitting? Now, when I say fee splitting, is there are some professionals in the fraternity who work commission basis while they do referrals. So we as a clinic, we don't take any money while we are recommending or referring to somebody, other professional. Neither we give money while we are getting referrals from other people. Yeah, other professionals. Always make it a point to put that across or ask, so you know whether they work on commissions or they don't. It's very important. So with termination, with fees, with commissions, with termination, other referrals is when we think that we are not being capable enough to do it, or if you as a client think that this therapy is not going anywhere or it's not as exciting as it could be, irrespective of putting in the efforts, always put that across to your therapist before terminating. Given the reason, see if a therapist can work through. If no, you can terminate, and the therapist or the counselor can refer you to somebody who is more qualified. Yeah. Professional qualifications are very important. And as students, I would want to put this across that there are many CVs that I get in where they have done the specialization in clinical psychology, but they put in a designation as a counselor, yeah, which is extremely wrong. Under your name, the designation needs to be exactly what your degree says. If my degree says MA in applied psychology, specialization clinical, I need to be true. So even in my clinic, my outdoor, my waiting area has all my degrees and certificates that I've done, mentioning the year and my degree, what it names basically. Yeah. Qualifications are very important because there are many Tom, Dick, and Harry, especially through COVID, that I saw. Everybody just wanted to be a lending here, wanted to help, which is great. But we don't know here if there is any subconscious or unconscious harm that we are doing to the client or the patient. So always be open enough to ask your doctor or your profession, whomever you're consulting, that, okay, maybe know what your qualifications are, and they shouldn't be feeling bad about it. Yeah, they're very important. Then comes the professional phase. Professional phase, why is it important? Is because when I was growing up, I still remember mental health did not really have much value to it. And it was always said that only the elite and the luxurious people can, afford mental health. But we've seen with time that people have actually argued that, and they're actually helping in sliding scales. And I feel very good when I read on WhatsApp chats and WhatsApp groups when people say, hi, we're looking for counselors or therapists on a sliding scale. So please, if any of you think you need help, or if you're going to be therapists or counselors, always consider Okay, always help. Probably take a session or two. I know we all have tight schedules, right? Right now, even if I am here, taking in your session, I am not seeing a patient then, right? We all have tight schedules. I get it. But it's very important that if we can be more accommodative and more inclusive. It's very easy if I'm here saying that, oh, we need to be very including. When I say inclusive, it also depends upon professional fees. So C, always put across and be considerate when it comes to on a sliding scale. Very important. Next, evaluation, assessment, and interpretation. Most of the times, the therapist will ask you that they require certain clinical psychometric tests and assessments, and the interpretation. According to the ethic, this can only happens after informed consent. B, the interpretation of it only and only happens to the client, okay, unless the client has agreed to discuss it in front of the informant, okay. And C is the assessments while we are doing nothing against any therapists or counselors in case you are here, but I have come across cases, probably very in minimal numbers, but I have come across where the assessments are the scoring, interpretation, and writing is being done by interns and juniors. So I would always request that it's our work. We need to do it because we are taking onus of it. It's not bad that interns cannot. Interns can do, but has to be under the supervision. So I would request when it comes to evaluation, assessment, and interpretation, you should be open enough because that's a part of a therapeutic relationship where you can ask as many questions as you want. And most of the times it can also be associated to medical legal. Now, when I say medical legal, basically means in case that if there is any medical condition, okay, can also have a legal repercussion to it. So if it has both a medical condition and a legal thing to it, then what? So most of the evaluation reports are liable that they can be produced and used as evidences in the court of law. So we need to be very careful while we are discussing and interpreting. Last but not the least, social media, very, 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 very important. My very favorite. This is a part of ACA, if I'm not mistaken. But moreover, I put this up here because I am seeing a lot of young therapists, a lot of young counselors, having the same web page or the same Instagram handle where they see clients, yeah, and where they are also accepting them as friends on social media. Guys, please, that comes as a part of boundary. It comes as a part of ethic that your professional and your personal both is thin line though, because you start to know your client. There's a thin line though, but both need to be compartmentalized. Yeah. Always have different pages for where you're educating, from where you are talking, and where you're giving knowledge to people about mental health or otherwise, and one where you are like on the beach sharing a glass of alcohol or doing whatever. Try keeping both different. I see a lot of overlap between this, which is not encourageable. I request your personal and professional web pages on social media needs to be different. Another thing when it comes as a part of ethic, why I put in social media is because we need to understand whether the social media, okay, are they social media influencers? Are they just there to help us and to give us education or knowledge? Are they indirectly trying to give us therapy? Or are they just soothing us? It's very important, because we might read a certain post and we might start associating that, oh yeah, wait, I think I qualify for 4 symptoms out of 5. No, guys, it cannot be that, because that is social media. The person who's giving you this information doesn't have your back history, doesn't have your entire case history. So you cannot be associating that, oh, I read on the social media and I think that qualifies. So on Astitva Clinic Instagram page, I have written a post. I wrote that, and my group of colleagues, made it very beautifully. They did some beautification on that post that says that Google might know your history, but it might not know your case history. So pun intended, that Google might know your history. When you're Googling stuff, it might have that history, but it might not know your case history. So please do not associate your own self, your mental health, your conditions, your symptoms to social media. Very, very important. And why did I put it under the part of ethical relationship? It's because most of the time the clients, after a certain given point of time, they become very curious to know how are you as a person in your personal life. And, they might see your WhatsApp status, they might see your WhatsApp display picture. So I always request that in case if they're part of your contacts on WhatsApp or social media or anywhere where you think you're sharing a personal space, please keep it different. Now, again, these ethics, this specific ethic is to each his own. Why should I say this specific ethic? I think majority of the ethics are to each his own, because irrespective of the ethics, we've seen people playing around or, using it at their convenience. But this is what I thought that it's important for me to bring it across to you guys. Yeah. Then comes in the limitations. As I said, that to each his own is the first thing that comes into it. And 3 important, which I thought of putting across where you guys know, is conflict between ethical and legal code. The law of land, of course, that goes without saying. When I say ethical and legal code, basically means our ethics that I just put across and that we all have to follow, and the legal ethics. So, for example, if I told you about the case where my ethics says that I have to maintain confidentiality, but if maintaining that confidentiality is doing some harm or otherwise, then I have to produce everything that I have the judiciary to look into it. You can always put in a thing that, okay, this is confidential. Rather, always make it a part of your informed consent, that in case where we think that there's any harm to you or your family or otherwise, or we think that you might not be able to take in decisions with the progress symptoms, and in case if it is required, we might produce it. Always put that as a thing and make it a point as an informed consent. Yeah. So there'll always be, a conflict, because your ethics are something that we're supposed to abide with. But then again, when it's the judiciary, when it's trying, it has a case, we need to put in what we completely know and fairly. Second is a cross-cultural issues, different cultures. I think more while I was writing cross-cultural is basically how, I'll give you one, my favorite example, which I keep using, is while I was doing a part of my ethic and it says contract and it said time of the session, the APA, the American Psychology Association, says it needs to be anywhere between 45 minutes to 60 minutes. But with my, and majority of the my seniors or my colleagues are also following it, but somehow me personally in my clinical practice, and especially when I have been the last resort, I have seen that, I get no good, or there is no good in the 45 minutes to 60 sessions. So at times if I have to, get it, it has to be far-fetched to 1 hour 15 minutes, I do stretch it, because if my client is crying, I can't say that, oh, I'm so sorry, please, it's 45 minutes up, you'll have to pay me 15 to 20 minutes. So let's be considerate. I know that's important part of the ethic and we have to follow it, but we need to know that we have a very different culture than the West. Probably it would be easier for the West because if, it's always been an assembly, right? Different kinds of people, they have different cultures. We are yet trying to take a step ahead to even decode in our understanding about what mental health is. Yeah, so cross-cultural issues are always, going to be there, but see what, design for yourself what is right and how you can make it work through. And 3, remember that the ethics, as much as they're important, they cannot be interest of all the parties. Now, when I say of all the parties, is if I have Anagha again back in picture. So she is a special educator and I'm a counselor. And if you've seen a kid, she might have a very different interpretation of the child. She might be able to do a 45-minute session. I might be able to do a 62-minute session. She might tell me that, I don't think he has a clinical problem, but I might be that, no, I think I am more qualified and probably I know with my expertise and my education into it that I think that he could have a probable diagnosis. So it can have a limitation because not all the parties can, come to one conclusion, but we make it a point more or less where we're abiding to the ethic and being extremely objective when it comes to the conclusion or the closure of the session. So these are the limitations which I thought that would be important for you all to know, because everything, as much as we want to abide, out of good intentions, we might slip at times. And it's always important to know not only the good part of it, but I always like encouraging that how there are certain limitations to it and how you young ones can actually come up with different things. And, you can always help us include the other limitations in case if you have anything in the mind. Yeah. So I did a lot of talking before, and I'm pretty much on time. It's 17:26, 4 minutes, and I should be good. I always do this after my every presentation. So it says, okay, Vishakha, I think you spoke a lot. 3 questions as self-introspection or reflection. You need not answer it to me. You can answer it to yourself or anybody who's going to pursue psychology. I was just informed that we are, because I'm doing professional ethics, we're doing majority from the same fraternity. So I put in these questions. Ones who are not there, probably you can just alter it to your profession and see if it makes sense to you. Yeah? Question 1, morals and ethics, I could associate to. So when I was doing the ethical dilemmas, principles, relationships, anything that you thought that naturally or organically that you already are doing something like this, like I maintain my boundaries very well, or I always give I always give an informed consent to my friend that okay, like, hi, I need to talk, are you in a great space of mind or no, before you start shooting. So morals and ethics you could associate to. Question number 2, will I make a good counselor? I still ask that to myself, that am I making a good counselor? It's not because I need validation, but that just helps me as my self-check-in and helps me, really reflect well on my doings after my each day, especially if my one specific day I've only done therapy or counseling. Yeah. And the third one is, how am I going to mark and create a difference in the mental health fraternity? I love this question because I like when young buds like y'all are so creative, y'all have such great ideas and alterations and quick responses. It always feels that, we need to upskill and keep upgrading with every generation probably that we see. I know that's very difficult, easier said than done. But it's always nice, if you guys can think about how you all can mark and how you all can create a difference in the mental health fraternity. So that's my favorite question, because I still keep asking that to myself, that, okay, wait, am I marking or am I creating a difference? Yeah, so that's pretty much about it. In case if I want the questions, I can go back.
Thank you so much, ma'am, for providing us with such insightful ideas that give us more information about professional ethics in counseling. Now we shall begin with a Q&A session. If anyone has questions, please put that in live chat.
Sure, you all can do that. But Dhruva, will you please be kind enough to read the questions to me if you don't mind? Because I'm not on the YouTube live.
Yes, ma'am.
I'm not very good with YouTube. So yeah. Yeah, as the Q&A come, I would just request, as we have students, guys, we do not have a website. We've really been working through the word of mouth. I would request if you all can put in your review, or you can put in your review on Google. If you just Google @Astitwa Clinic, Matunga, Mumbai. And if you can just put in a star, whatever it is, 1, 3, 5, any feedback, any review would be very, very helpful. And social media, Instagram, or Facebook, in case if you can just follow us and just let us know how the session was, because we are only and only working through the word of mouth. We have no website. We are very traditional and old school. Yeah. Any questions? I'm happy to take.
Yes, ma'am, we have a question. The
Sure.
question is, can we practice outside India with degree taken from here?
Okay, so that completely depends upon what your degree is. So if you're considering the West, they ask you to do the master's going back there, because they don't consider our degree at all. So you will have to do your master's if you're moving abroad. Again, Canada is, so that I'm speaking completely about the United States of America. I'm talking about the US. Again, when I'm considering Canada, it's very skill-based, so it's very different. But if you're thinking, and I always suggest when it comes to psychology, I think it's US which you should be hitting, because when it comes to clinical practice and education, US is better. When it comes to research, I think this is good. Europe is good. So yeah. No, because here we don't even have the licensing, right? Like in the West, if you consider, they have licensing upon each state. So in case if I have to move from one state to another, the culture is different, the ethics are different, the form, the way of functioning, the lifestyle is different. So it's very different. So no, again, you need to know which university accepts what, but as much as what I have known, you have to do your education if you're moving abroad.
Okay, ma'am. Thank you so much.
Any more questions, guys?
We have another question.
Sure.
Can we do diploma and degree in India and do masters in foreign? So the same question.
Yeah, you can do that. So we have the open university, IGNOU, that provides us. You can do the diploma courses, but again, because the licensing part we are in between for, especially clinical psychology, counselors are taking care of. I would always suggest, why not do quality? I mean, how is the quantity helping? So I know so many people in between. There was a trend of CBT, REBT, and everybody was doing CBT, REBT. Then we had art-based therapists, and everybody was doing arts-based therapists. So yeah, you can always do that for upskilling, but as your formal education, I would always encourage people to do their UG in psychology, do your PG in psychology, and then to upskill and upgrade, you can always take up diploma courses.
Okay, ma'am. Thank you so much. We have Muhammad Ali Ghabrani's review.
Yeah.
He says, it's so good to see you after almost 2 years. It was really informative session, a very neglected topic among practitioners these days.
Thank you, Mohammed. Please, if you could put this on Google, it will just help. So yeah, thank you. And I'm so glad he remembers like after 2 years. Wow, that's good to see.
So we have another question. How much should a counselor let on in case being interrogated by a police for a case, maybe for suicide or any crime? What is the ethical code here?
Sorry, can you come again, Rufa, if you don't mind?
Yes, ma'am. The question is, how much should a counselor let on in case being interrogated by a police for a case, maybe suicide or any crime? What's the ethical code here?
A, do you have informed consent by the client and by the parent? B, why are you pulled in by a cop because that's not your place to be? C, if you are at the police station and you know what your expertise is, what is your designation that you're going on with? D, if you are the designated counselor who was working, just allow me a minute. Hi. Okay. I'm doing the session, okay? Sorry, guys, just a minute. I have like a kid who's come for his session. Just a minute. You like it? Yeah. Okay. You can eat one.
Thank you. Can we say thank you?
Yeah?
Yummy.
Right. Sorry, just give me a minute. Yeah, and D, if you are there, it's okay. Let him be.
Come, we'll see and check. We'll see whether your chocolate is there or not. Take it.
Sorry for that. And D, if you are in there as a counselor and if you have your A, B, C, D in place, and if it's going to help to get him justice or fairness, and if your client is okay with it, you can. It completely depends upon what and under what circumstance and the context that you're put in there. So I wouldn't be giving you a 2 + 2 4 as an answer here because there are too many factors associated in your heads. But I told you that what your flags should be, and then you can decide whether they're red or green. And if you have the informed consent, to go ahead with the information to be given.
So another question we have is, what if these codes are being violated? Who takes care and who takes the action?
Once again, what is being violated? Codes.
Yes. What if these ethical codes are being violated? Who takes the action?
Codes. Yeah. Okay. So codes again. That's a very nice question. So codes, if I have to put in there, actually we are still getting into having one association under, for psychology and mental health. So RCI, the Rehabilitation Council of India, has an association where it gives you a license to practice clinical psychology. So under that, there are different things that you are, liable to in case if you misuse it. And for counselor, we are still figuring out whether they fall into the general health of the government or no, public health or no. So as such for now, because we have no one association, hence we have a lot of people only with diploma and only with open education or only with one certificate course are practicing, mental health and psychology. So as such, now I think we are moving towards having punishment or liability or accountability involved in here. But for now, I think we have a leeway given because licensing is what we're just starting with. And I think RCI has made it compulsory that if in case you want to practice clinical psychology, you need to be RCI registered. So under one association, you are accountable and liable that if you are breaching any code of conduct or any code of ethic. Want to say hi? You want to say hi on screen? Yeah, 1 second. Guys, can you please tell him a hi? No. Okay. He's just very curious to know what I'm doing. Yeah.
So there's the last question. Can we do internships while doing degree? And where can we do internships in Mumbai?
No, please don't. That's your time to study. Please study. I have students, so because I'm also a visiting faculty at Adria College and University of Mumbai, and I have TY students who come and tell me that I want to do internship, and I'm like, internship for what? I mean, you do not even have your specialization. You are still studying. How and what is going to help? I know there's a lot of rat race because many people are interning, and I always say, no, that's your age and your time to study. So get your knowledge in place intact, then come and intern. I'll be more than happy to take all of you as my interns. But first finish studying. I do not encourage that because you're in your degree college, you study, do research, figure out what is happening overseas, try to correlate between us and the West. But yeah, I never encourage interning at UG level. It can always be at a PG level where you know what a specialization is and what you're interested in. I know the following question would be, but ma'am, we want to know whether you are interested in clinical or counseling or industrial. So for that, you can always call me up or call psychologists or mental health professionals around you and ask them if you can come and speak to them, where they can tell you that what is the nature of work under each specialization. But I'm sorry, I do not entertain internships at a degree level. That's your time to study. So just study, be a student. It's nice to be a student for the longest of time and then come and work as an employer or the employee. So yeah, sorry if that hurt anybody.
Okay, ma'am. So we have the last question now.
I think you can ask me as many questions. I love answering questions. Yeah.
How much is a professional obliged to disclose about a client to the family members in case where the client has passed away?
Okay. So that's again a very good question. So for this, I would request you to follow the Mental Healthcare Act, which was published by the President of India, 2017. It comes under different codes, so under what context and what and how you have to say it. So I won't be saying this, but one thing that if this has happened, and if you have now, again, death is what? Is it natural death? Is it due to neurodegeneration, meaning, the brain getting degenerated? Is it because of active psychosis or is it by suicide? Yeah. So again, under what context has the death happened? A, and B, do you have any information and do you have the consent to put it across? Because we don't know that we might go to do something good by letting the family know, but we don't know if we might end up doing harm just because the person is no more and there is nobody checking on us. So again, please refer to the Mental Healthcare Act 2017. In case if you all want, I'll be sharing both the links of ACA and the Mental Healthcare Act. You guys can go through. Because this comes with a lot of pointers, which I wouldn't want to loosely, say to you guys. So yeah, but a very good question. Very good question.
Thank you so much, ma'am. We are done with our questions.
All right. No more questions? Nobody from here wants to ask questions? I can't see YouTube people, but yeah. Are we good otherwise? I know would have been a little technical, but these words need to be technical, and hence I kept the words just the way they are. So in case anytime that it falls in your ears or know that you'll have heard about it, and I simplified the content under each of them. So I hope that helped.
Yes, ma'am.
Yes, ma'am. So before I propose the vote of thanks, here are a few important announcements. So the link for the feedback is shared in the live chat and WhatsApp group. Participants are requested to fill the form for the e-certificates. So the feedback will be open only for 1 hour, the feedback link. So please fill the feedback form. So on behalf of NSS Unit and Department of Psychology of Royal College of Arts, Science and Commerce, Mira Road, I express my heartfelt gratitude to our resource person, Ms. Vishakha Punjani. Thank you, ma'am, for compelling us to deliberate on the various ethical concern in counseling. Thank you, Vishakha ma'am and Ananga ma'am, for taking time from your schedule to be with us. Thank you. We earnestly express our gratitude to our principal, Dr. Vikas Vedya, and Vice Principal Malika ma'am for encouragement and guidance throughout the planning and organization of this event. We recognize the efforts taken by the organizing team. We truly appreciate the efforts taken by the student volunteers. We especially thank Professor Swati and Professor Anushka of Computer Science Department for facilitating the technical support. We thank Mr. Hussain of TYBMS, Miss Ronak of TYBCom, and Mr. Joel of TYCS for the technical assistant. We appreciate the efforts of the student support team for helping in the promotion and technical assistant of the event. Thank you, live audience, for joining us today and making this event a success. Lastly, but most importantly, on behalf of the organizing team, I express my deep gratitude and heartfelt thanks to our founder, Sir Professor A. Lakrawala, for being the firm foundation on which we all are standing and enjoying the growth and glory. Thank you, sir, and the management for committed support for all our ventures. Thank you, everyone, for joining us. Hope you had a meaningful time with us. Have a nice day.
Thank you, Sana. That was very, very, very sweet of you. Again, my big thank you to everybody you said. I would completely second it. And a bigger thank you to Rita, because guys, I think she's really going miles ahead to give you everything in the curriculum that she can fit in. And also Malika ma'am, I think even she's been very encouraging. So yeah, thank you to everybody who was present here on a Friday afternoon after a good lunch. And I hope you guys, go away with some takeaway and have something to think about. Yeah. Anaka.
Thank you, Rita. Really, thanks a lot. Let's keep the association going on, and thank you, everyone. You've been a lovely audience. I'm sure you have loads to take back. Keep in touch. Thanks, Rita.
Thank you guys, and thank you everybody who also came in live on YouTube. And I'm extremely sorry, I think I'm very poor when it comes to technology. So yeah, to everybody on YouTube and on Zoom, thank you so very much for having me. Thank you. Could I stop sharing and could I log out?
Yes, Vishakha, we know you have plans waiting for you. Get going. Thank you so much for being with us. Squeeze time for us. Thank you.
Thank you, Rita.
Thank you.
Bye, guys. Thank you, and good luck to all of you.
Thank you, ma'am.
Thank you, ma'am.
Thank you. Bye, Sana. Bye, Rufa. Bye, Sanya. Bye, Mary. Bye, Rita. Bye, Miss Royal College. Bye, Ronak. Bye, Alia. Bye, Afsha. Bye, Sada. And bye, TYBMS 48 Hussain. Bye, guys. Take care. Good luck.
Bye, ma'am. Thank you.
Bye, ma'am. Bye, ma'am.
Ma'am, we'll wait for 10 minutes until the link has been shared and everyone fills the feedback form. And after that, we'll be closing the live stream.